All measurements should be made on the right side of the body with the subject standing upright. The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and the finger, perpendicular to the skin fold and halfway between the crest and the base of the fold. The pen should be maintained while reading the caliper. Wait 1 to 2 seconds, not longer, before reading the caliper. Take duplicate measures at each site and retest if duplicate measures are not within 1 to 2 millimeters. Rotate through these measurements and sites to allow time for skin to regain normal texture and thickness. For the abdominal, it was a vertical fold 2 centimeters to the right of the umbilicus. Next is going to be for the triceps. It's a vertical fold on the posterior midline of the upper arm, halfway between the acromion and olecranon process, with the arm held freely to the side of the body. Next will be for the chest. It's a diagonal fold, 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. Next will be the mid-axillary. It's a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method, if necessary, is the horizontal fold taken at the level of the xiphoid process in the sternal border and the mid-axillary line. Next will be the subscapulary, which is a diagonal fold, approximately 45-degree angles, 1 to 2 centimeters below the inferior angle of the scapula. Have the patient move their arm back to ensure that the inferior angle is noticeable. Next will be the measurement of the suprailiac. It is a diagonal fold in line with the natural angle of the iliac crest. It is taken in the anterior axillary line immediately superior to the iliac crest. Next will be the measurement of the thigh. Have the patient slightly bend their knee. It's going to be a vertical fold on the anterior midline of the thigh, midway between the border of the patella and the crease of the hip. First, you're going to add up the sum of the skin folds. To calculate body density, you simply plug in the sum of the skin folds into the equation where it has the placement for them. Be sure to use the equation for males and females as necessary. Using the series equation to calculate body fat percentage, you take 495 divided by body density minus 450. For the Brozek method, you take 457 divided by body density minus 414.2 to get the body fat percentage.